welcome the first presenter for today. Our first presenter, our first presenter for today is Miss Nwatu Jessica. Miss Nwatu Jessica is a dental therapist who graduated therapy in Enugu. She is currently pursuing her bachelor degree in dental therapy. She practiced at Nigerian Navy Reference Hospital and did her internship at Military Hospital, Lagos. This morning, she is presenting on how to gather health data in the clinic. Ms. Nwatu Jessica, our first presenter, the floor is open to you. You are welcome. You can unmute yourself and get your presentation started.
Good morning, everybody. Hello? Can you hear me?
Good morning. We are here.
Okay. My presentation today is how to gather health data in a clinic. The outline for the presentation is as follows: the introduction, the classification of health data, sources of health data, how to gather health data in a clinic, the conclusion, and references. First and foremost, health data, they are items of information or knowledge that we gather from patients to help us in our diagnostic process. Health data they are items of facts, of knowledge, as we can see on the slide. There are groups of health-related facts about individual patients, group of patients, a population, from which information about that population's health is gotten. So for every health data collected, there are purposes why they're collected. It's either to advance treatment methods, to improve communication between doctors and their patients, or doctors and doctors, to make patient diagnosis. So an important factor or function of collection of health data is to help treat a patient better. So that's by way of introduction. So health data is classified into two types: the structured and the unstructured. The structured type of health data, they are standardized facts. We know that a patient's name is Nwatu Jessica. We know her specific blood group. We know her specific genotype. Those ones are standardized. They are measurable. You can see them like hard-written facts. They are certain. A person's date of birth and others. A patient's X-ray results, for instance, it's certain. It's not like it passed through other people. It was just taken and a result was made and it's standardized. It's certain that this result is for this patient. So the next type, the unstructured type, these ones are the opposite of standardized. They are still health information or health data, but they are gotten through indirect means, if I may use that word. Say a patient calls me and complains about he or she having halitosis, for instance, mouth odor. Then I try to write out, after the conversation, I try to write out the patient's complaint and everything. That kind is unstructured because somehow I may have lost some information in transit. I may have changed some of the words. So those ones are not structured. They are the unstructured type. That's it for the classifications. Now, the sources. How do we gather health data, basically? There are various methods of acquiring health information. Examples are surveys, administrative and medical records, claims data, vital records, surveillance, disease registry, and peer review literature. But for the purpose of this presentation, I'm restricting the sources to only those that are related to the clinic, as my topic had stated, health data in the clinic. So I'm restricting the explanation of the sources to just those ones that can be gotten from the clinic. So the first one is patient medical record. It's the one piece of information or paper you can look at and know everything pertaining to a patient's health history. A patient medical record is a documentation of patients' past medical history, dental history, social, like literally everything you need that would guide you in the diagnostics of a patient's problem. is in a patient's medical record. So a way of gathering health information is through patient medical records. For instance, this kind of gathering information is, say, the patient medical record has already been collected, and then you want to know more about that patient. You use his or her medical records, her patient's folder, to know more about that patient's health issues. In recent times, no, sorry, the next slide, the previous slide. In recent times, the introduction of electronic medical records in place of handwritten options have increased the accessibility of patients' files. This means that since recently, because people or hospitals or institutions now are switching to the technological aspect of health, they now put their patient health records online or in a system backed up by a software, so that if, say, a patient comes to the clinic today, you can just input the patient's name in the system, and everything you need to know about that patient is brought out. In contrast to the previous way, where they come to the records office and you have to start looking for their folders and their card numbers and every other thing. So this electronic medical record is sort of like a modernized, a better way, or a better form of the patient's medical records. So the next slide, please. Administrative data. This kind of data is sourced from organizations like the National Health Insurance and the rest. Ideally, health insurance schemes or agencies should contain information about patients, their illnesses, their treatment diagnosis, their proposed outcome, or their prognosis. So if I key in a patient's NHIS number in the NHIS database, I should be able to know the patient's history. What illness is the NHIS covering? How what is the possible prognosis of that illness? How was it diagnosed? I should know the health condition of a patient, or the progress of a patient's condition, when I look through his or her NHIS database. Ideally, it's how it should be. So that kind of health data is the administrative kind. It's not gotten in the hospital or anything. It's gotten with service providers or healthcare providers or agencies. They are sourced when patients' medical records are not accessible. Say in the case of an accident and the patient is unconscious and there's no family member. And luckily, maybe in his or her pulse, there's the NHIS slip. We should be able to gather information about that patient when you just click the NHIS code of that patient into the NHIS database. So it can, administrative data can be gotten when patient record is inaccessible or the patient is not available or able to give his or her own history. And the next one is surveys. These are an important means of collecting health data. If I want to collect a survey about pregnant women who have periodontitis in the clinic, I can share questionnaires to the patients that come to the dental clinic, and then they would fill it. From there, I would get health data, kind of, because in that way, I would know who of those, who among those patients, those pregnant women, have done previous cleaning and polishing, how many of them have had extractions and all that. So from surveys, it's no more personalized. You can do it now encompasses a group of people, a collection, a population of individuals who may or may not have the same kind of health problem. So the disadvantage with surveys is that because of a lack of personal interaction with patients, there is unwillingness sometimes for a patient or a respondent to tell you the truth. Basically, if you give them a questionnaire paper, it's possible they will just tick off options that are closest to them. You may not get real hard facts from surveys, although they are, but I'm just saying it's sometimes the unwillingness to say something or hear or properly understand what the questionnaire has requested may be a problem in the use of questionnaires to collect health data, surveys in that case. The next one is vital records. Here it doesn't just mean the blood pressure, the pulse, and all that. It doesn't just mean that. Vital records here mean records of birth, mortality, fertility, everything that are vital. A patient's history of childhood disease, of congenital defect. Sorry, patient's history of death, causes of death. All these ones are gotten from maybe our local governments, or in the hospitals, big government hospitals, where they have records of people who were giving birth there, people who died there. That way can also be a form of collecting patients' health data. Then the next slide is how to. I've listed all the sources and ways it can be obtained, but there are specific ways to gather them. The first one is questionnaires and surveys. I've explained that earlier. For questionnaires, they are written documents that people tick options in. Basically, you ask them questions and they answer you. Interviews are more in the patient medical records area. You sit down, you have a conversation with a patient. It's not interview per se. It's supposed to feel like a conversation rather than an interview, to get the patient to open up, to relax, to tell you what his or her complaint is. Then documents and records is more to the administrative kind and the vital records kind, as we saw in the sources. Those ones are sourced from administrative data, online servers of health agencies and all that. Observation can be done during interviews or conversations with patients during patient medical record. All these ways to gather health data are not used or cannot be used in isolation. You combine them. Say for questionnaires, as you're sending out your questionnaires to the patients, you're observing them. Are they healthy looking to you? While you're interviewing a patient, you're checking if his or her face is symmetrical. You're checking if they have swelling on their face, if their hands are pale. These ways of gathering health data are used together in concurrence with one another. Focal group conversations is more to the group side. You sit a group of people, say maybe during an oral health awareness outreach, you sit them down in the clinic, you talk to them and they talk to you back. From there, you get health data from them. Indirectly or directly, they are telling you their concerns, the illnesses that ail them, and you're providing treatment options or encouraging them to seek proper medical care. In that form, you're collecting health data in whatever form, whether it's structured or unstructured. You're sourcing out health data from them. The next slide, please. In conclusion, health data is a primary way of helping patients treat their disease, because I cannot treat what I don't know. You cannot expect to properly solve or relieve a patient of his or her pain if you do not know information regarding that patient or that group of people. So it's a very integral part in healthcare delivery, because if health data is not collected for whatever purpose it may be collected for, maybe for diagnostic purpose, for research purposes, for whatever purpose at all, if health data is not collected, it will restrict your patient's care delivery. It will restrict the patient's health in terms of how he or she relates to you or you relating to them. So patient health data ensures that care remains at an optimal level. This way, if you have a health data of a patient in the dental clinic and for some reason he has an ophthalmic issue, it's easy for you to send your health information to the eye clinic, because there's easy transfer instead of them having to sit down and go through all the process from the beginning. So health data just help smoothing the process of healthcare delivery. These are my references. Thank you very much.